que Michele Diana está conectado desde el IRCAT y nos va a hablar de hacia dónde vamos, cuáles son las aplicaciones y cuál es realmente el impacto de la nueva tecnología que está teniendo en el mundo. Michele.
Anyway, so Fernando, I'm at the moment and since 2 months, I'm in Switzerland. I'm no longer in Strasbourg. I'm now in University Hospital of Geneva. Yes. Okay. So it doesn't matter if you don't see me. So yeah, I liked a lot the request to talk about the emerging trends in surgical optical imaging, and a few disclosures. So surgical optical imaging is really the modality of choice, in my opinion, to do image-guided surgery, as it enables us to see invisible things, and in terms of anatomy, but also physiology. Functions. Thank you. So we published this paper years ago in which we gave an academic classifications to the surgical augmented eye in terms of ability to see by transparency, thanks to virtual and augmented reality, in terms of seeing the microscopic in real time with technologies as endomicroscopy or optical coherence tomography, and the ability to see the invisible with the help of fluorescence imaging, or multispectral, hyperspectral. That's what we will talk a little bit about. So we gave a name to surgical optical imaging as a sort of new omics science. We call it surgical optomics. In the recent years, we moved a lot into the combination of software, machine learning, deep learning, and surgical optical modalities in order to obtain quantifiable tissue features and functions during the surgical procedure. So we call it surgical optomics. And I will detail a little bit more what we are working on. So what we do is that we measure and interpret light tissue interactions. So there is the phenomenal fluorescence that you all know now, which is a photon that is emitted upon excitation at a given wavelength into a different level of energy. And the machines that we use, the endoscope that we use, they capture this difference in energy. But there is a lot more to exploit in terms of light tissue interactions. We can exploit the absorption, the scattering, the reflectance, to obtain imaging, meaningful imaging that provide quantitative data right after. And so we have to distinguish, this is very important, the exogenous information. So the exogenous information is provided upon injection of a fluorophore, like in the cyan green, or by visualization of a natural fluorophore, a natural chromophore, like for example in the case of autofluorescence of parathyroid gland, and the endogenous information, which we don't use a fluorescence phenomena, but we use absorption, scattering, and this can provide functional imaging in which we can measure the hemoglobin content, the oxygen saturation, the lipid index, the water index. And with all this, we can do a kind of chemical analysis of tissues. And so the trends, this was the unit that I could create in IRCAD, in Strasbourg back in time. The trends that we were focusing on were fluorophores, hardware, software, and also education. Those are really the main pillars to move this world forward. In terms of fluorophores, so fluorophore means the carrier of light, right? What is really, really interesting to overcome the limitation of indocyan and green, which is a small molecule that diffuses, that is not targeted. There is a bunch of research about targeted fluorophores. So fluorophores that have an address That can be a monoclonal antibody or a small molecule with a specific mechanism of being to penetrate the cell, the tumor cell. And particularly within the framework of a European project with my PhD student Rita, we worked on a very nice molecule, which is the ME-137, which is an anti-CMET. And in this CAST project, the aim is to use this molecule to do a follow-up in a patient with rectal cancer that undergo a neoadjuvant radiochemotherapy, and then by an endoscopic approach, follow up if this anti-CMET is still uptake. We did some preclinical work also up to the human specimen, and it is really it's a very promising molecule. But these are molecules that require a very, very hard regulatory pathway. And in terms of fluorophore, we decided to take a different pathway, which is more with the device rather than the drug pathway. And we created a molecule, which is a polymer combined with a cyanide, which is 30 times brighter than ICG. It's very stable, is biocompatible, and it can be used as a coating. So literally, we can use it to coat surgical instruments and then functionalize them, providing them with a fluorescent ability. And for example, we have used to coat endoscopic clips that can be placed by the gastroenterologist to mark a tumor, next to the tumor. And then by laparoscopic approach, you can see them beautifully when you switch to the near-infrared light. So this is a cadaver study on the stomach, for example, and there is a calibration aid next to it to allow for measuring the intensity and also understand how deep is the device. And here we coated the ureteral catheter, so a double J. And as you see, this is a cadaver model as well. See how beautiful you can see the ureter. And if you consider that generally ureteral lesion is due to a lack of understanding of the anatomy, because maybe there is a diverticulitis or there is an inflammatory status that prevents you from seeing well. When you see this beautifully, maybe it is less at risk of injury. We are exploring in terms of hardware also the so-called second window of near-infrared. Means a longer wavelength, which means a lower level of energy, which means higher penetration. In the second window of near-infrared, we can estimate to be able to penetrate almost between 0.8 almost to 1 centimeter depth. And this is for now just an open field camera. Is produced by a French company called Care Labs, and we did some preclinical tests, and this is also very promising. And you can add a couple of layers more of tissue before you lose the fluorescent signal. This is very, very useful. And there are some companies that are starting producing minimally invasive endoscopes provided with near-infrared 2 sensors. In terms of endogenous imaging, we are working on several hardware. And in surgical optomics, so with a hardware plus deep learning algorithms. So endogenous imaging, particularly hyperspectral, is the use of a lot of wavelengths, up to 100, to scan the tissue. And basically all these light tissue interactions combined with a spectroscope can enable to really obtain a signature of the tissue. The machine that we were using here, it's called the Tivita, has some preset algorithms. It provides STO2, so the oxygenation, if you want. It's not the perfusion, it's the oxygenation of the tissue. The near perfusion index and the tissue water index. It has a problem, some limitations. is that the physiology image is displayed side by side and not overlaid. And then the second problem is that the video, there is no video rate. So you take one picture, it takes 7 seconds to provide you with the physiology information. So we did a couple of preclinical work to improve this. We modified a little bit the machine. We added a webcam, we added a laser to measure the distance, and with some augmented reality work that were well known in the institute, we obtained, for example, a merging of the images. In this case, you see, for example, a model of hepatic ischemia. And so the physiology, the hyperspectral captures the SpO2 or the perfusion index, and then converts into images, and then the images are overlaid in line of sight so that the surgeons can follow, for example, the demarcation line, as you see in this case. But this is not all, because this device also provides numbers in terms of oxygenation, and we verified that the oxygenation that was provided here is in a case of small bowel ischemia. We wanted to verify that the SpO2 information was corresponded to what was ongoing at the level of the cell metabolism. So we measured capillary lactates at every point and on the bowel, and then we wanted to know by plugging a prediction algorithm how accurate it was, and it was really accurate. And you see, this is in patients, so we then moved to clinical application. So this is Manuel Barbero, was a PhD of mine, and you see, this is so he was ready to do his own resection. He marked with he was very proud, because in this case, you see his line, which was by clinical appreciation, it was predicting, I will cut here, and this was very nicely corresponding. You see this, the red means that's nicely oxygenated. So he was very proud because it was almost at the point. But actually, when we extended to in this case was 115 cases, actually only in a little more than half of cases our eyes correspond to the SpO2 appreciation by hyperspectral imaging. And as I told you, the hyperspectral is very accurate in sensing the level of lactates at least. So the metabolism that's occurring at the cellular level. So only in 50%, a little more than 50% of cases, our eyes are as good. And in 22%, the clinical appreciation was almost entirely within the ischemic area. So this machine can do a lot. And by combining with machine and deep learning algorithms, what we could obtain was the signature of tumor in different clinical applications. For example, this trial was called Ex Machina that we did in Strasbourg. We included 77 cases. What you see here is a piece of colon with a tumor that we opened like a book, and then we scanned with hyperspectral. And the signature of the tumor is so different, the spectral signature of the tumor, so different from the normal, that by only including 10 cases, where we tried several architecture of CNN, convolutional neural network, 14 in total. Only in 10 cases, thanks to the separation of the spectra, we could obtain an accuracy of discriminating tumor versus non-tumor tissue on 93%. And we created this software that basically can show, you see this orange thing here, can show where the tumor is based on a decision threshold that you can adjust, whether you want more specificity or more sensitivity. And this was holding true with a 95% negative predictive value when we extended a little bit to 32 cases. But coming back to Ex Machina, which was mostly, since the machine is an open one, was mostly for hepatobiliopancreatic cases. Elisa Bannone, my last PhD, she graduated on the 18th of March. She did this beautiful study, a training set, the training set in Strasbourg. She applied on a testing set in Verona. and the machine could autonomously recognize with a 95+% accuracy 13 different tissues. So this was autonomous tissue recognition thanks to hyperspectral plus artificial intelligence in 170 patients. And this has just been accepted and will be published soon. And when she restricted to, so in Verona, is the second largest center in Europe for pancreatic cancer. They operate 450 pancreas a year. Just right after Heidelberg, they do 600 per year. So it's a very high volume center. When they tried hyperspectral to see if they could predict somehow the occurrence of pancreatic fistula, it was found that the hemoglobin index was a predictive factor in cases that were having post-operative pancreatic fistula. And this is something that requires more data, but is also very promising. And also in the same data set, she was focusing on liver cancers, 68 patients, 21 HCC, 47 metastases, and the hyperspectral plus CNN, again, was able to discriminate cancer versus non-cancer, but also this with a 95% specificity, but the sensitivity was low, 78%. Why? This is because the liver is highly reflective. And so we are working to solve this issue to reduce the reflectivity, because this can influence the output. And to solve the problem with the lack of video rate, well, this is a problem. So we are focusing now more on multispectral rather than hyperspectral. So less wavelengths,
Michele,
10 rather than 100.
Sorry. Yeah, this is amazing. We have like only 3 more minutes.
Okay, yeah, sure. It's finished.
This short video.
So this technology is called single snapshot optical properties, and as you can see, it can provide you a video rate, so in real time, and we are now trialing this in patients. We are doing a safety trial in Strasbourg. It's almost finished, and then the other technology, which is very promising and interesting, that evaluates perfusion, not oxygenation, but perfusion, is the laser speckle. We tried this machine together with Nicole Bouvet from Maastricht, in which we could evaluate, thanks to the measurement of lactates along the bowel, that is also very accurate. And this is the last slide. So this is I wanted to tell the trends that we do believe are very important. So fluorophore, targeted fluorophore, extremely fascinated, but a very highly complex regulatory pathway to follow, and the surge of those new optical imaging technologies that are contrast-free, that together with CNN-based deep learning approaches can really promising to provide discrimination and real-time physiology assessment. And I thank you for your attention.
Thank you very much.